All right, so welcome everyone. So we are here today to discuss our Health Leads Network Forum, how social need programs are shifting during the pandemic due to increased demand for essential resources. Today's topic is on community partnerships, and really excited to have you all here with us to discuss this. So my name is Megan Pizzaki. I am a Director of Communications here at Health Leads, and I am joined today by three lovely panelists who are going to share their expertise with you and also just be part of our fun conversation. And so first I'd like to introduce Barbara Baumgartner. She is a project coordinator at Catholic Health Initiatives St. Joseph Health in Lexington, Kentucky. She coordinates the Total Health Roadmap grant in Kentucky for CHI, which ensures basic human needs are addressed as a standard of care. They leverage the status of CHI health systems as anchor institutions in their communities, and they build broad-based community coalitions that can lend assistance. Our second speaker today, we have Cheryl Parquet. Cheryl is the Director of Community and Diversity Engagement at Blue Cross and Blue Shield of North Carolina, the state's largest health insurer. She's responsible for the development and implementation of all corporate-based philanthropic initiatives, including community investments and outreach programs, employee volunteerism, and major community initiatives and strategic partnerships to help improve the health and wellness for everyone in North Carolina. Finally, we have Tiffany Scruggs. Tiffany is the Director of Benefits Outreach and Client Services at the Greater Cleveland Food Bank. Tiffany oversees both outreach and help center teams to lead efforts to connect individuals to apply for SNAP, public benefits, and other valuable resources. She is also on the Greater Cleveland Food Bank's Diversity, Equity, and Inclusion Committee. And so before we dive into our discussion, I'm going to review a few helpful housekeeping information to really make sure we have an engaging, interactive conversation today. So the first thing that we would love for you to do is just take a second to make sure you have the following panels open: the participant panel and the chat panel. You can see in this image here, the participant panel is this bubble that has a little human on it, and then the chat panel has a little chat box. So these are ways that you'll be able to communicate with the panelists and with each other during today's conversation. And if you have any issues with your audio, you can hit the audio connection info button, which is those three dots, and it will help you connect via phone or via your computer, and it will give you the event number, attendee ID, everything you need for that. So the chat function is a really important one, as this is, again, a really interactive discussion today. And so the chat function is found on the bottom right hand of your screen. Once you've clicked that bubble, that should pop up. If you experience any technical issues during the call today, please private message the Learning Network. You'll see that in the drop-down menu. Otherwise, every time you send a message, please send it to all attendees so that everyone can see your question or your comment. And so if you want to raise your hand to come off of mute, which we definitely encourage today, like if you want to speak to us and share your experiences in more detail, you can raise your hand, which you just have to click this little hand icon and on the bottom right hand side of the screen, and Christian will be able to help you take off of mute. Again, send all of your questions to all participants, all attendees. And if you want to come off mute, you can just click the speaker button. And just an announcement of we are recording this webinar and we will share it out afterwards. So that's everything. If you have any questions, you can message us. So thank you, everyone. So for those who may not be familiar with Health Leads is an innovation hub that runs both national and local initiatives that address the deep societal roots of racial inequity that impact our health. And so as Black and Brown communities are disproportionately impacted by COVID-19 because of structural racism, here at Health Leads, we're really focused on both helping communities respond to immediate essential health resource needs and rebuild equitable systems for the future. And so Health Leads has really responded to COVID in 4 core areas. So the first one is building community-owned crisis-resilient tech infrastructure. The second is connecting people to essential resources using displaced workers who need an income. The third is creating community-owned data to identify gaps, enable local collaboration, and rebuild national and local systems. And fourth is sharing learnings and connecting folks so that they can learn from each other, which is why we're all here today. And so I wanted to share a little insight specifically into this Health Leads Network Forum. So we sent out a survey to our Health Leads Network, our partners, a lot of you on this call. We asked what would be most useful during the COVID-19 crisis. And what we saw was really the need for people to be able to learn from one another and how they can adapt their social needs programs during this time. And so whether that be strategies to support the most vulnerable populations, guidance on how to navigate current resource availability, or, other, like, how are you doing with technology, or what platforms are you using? But really, we wanted to create a space where everyone could, really support each other by sharing promising practices, resources, and learnings that really help you meaningfully and equitably adapt your social needs programs during this time and for the future. And so what we've done is this is our, I believe, our 5th network forum. If you've attended any of them before, we've covered quite a few topics, but today we are focusing on community partnerships. And so what we're going to do is going to take a deep dive into this primary driver of social needs integration. And so when we think about community partnerships, we're thinking about what community-based partnerships are critical to the health of your community members, especially now during COVID-19, and how can you continually improve access to resources while keeping equity at the center. And so what we're seeing right now is that communities that have had strong referral networks and partnerships in place before COVID have been able to be in a better position to respond, whereas communities where partnerships were lacking or there wasn't a lot of trust, community members are really struggling to get the support they need because of that mistrust and lack of engagement that's been existing. And so during today's discussion, Barbara, Cheryl, and Tiffany are going to share how they've leveraged their community partnerships to make sure that their community members have access to the resources they need, especially during this time. And so we're going to hear what has and what hasn't worked when maintaining and building equitable partnerships, including community and patient voice in addressing resource needs and gaps, and what it looks like to create a new normal to address community needs. And so today is a discussion, and we really, really want to hear from you. So what we're here today to do is really brainstorm, share and learn from each other, help mobilize improvements in communities across the country. And so I just want to say as a reminder that even sharing the smallest insights or best practices truly matter and can really make a difference in someone else's community. And so before we kick off our discussion, I really just want to encourage you to ask questions, come off of mute, use the chat box, and share what's happening in your community. And so I see we've got some questions already coming in, which is fantastic. And and so what we're going to do is we're going to start off this discussion. Each of our panelists are going to share a little bit more about their program, and then we can start answering some of your questions and really start diving into the challenges and solutions around community partnerships, especially right now. So with that, we can start. So Christian, we can take the PowerPoint away. And my first question to our lovely panelists here is we've seen, as I've mentioned before, we've seen communities with strong community partnerships already in place, really be able to respond quicker and more efficiently during COVID-19. And, I'd love for each of you to really, give an overview and share what that looks like for your organization or your community. And Barbara, I'd love to start with you.
Okay, thanks, Megan. So here in Kentucky, probably like everywhere else, the governor pretty much closed most things down as far as resources that were available and being used by our community health workers. And so what we found is that those community partners that we had spent the most time with and worked the most, invested most of our interest in, those were the ones that were even on board, even when they couldn't be a part of things. So it was very interesting to see that those partners actually did things like open up doors and let the community health workers come and pick things up, even though they were basically closed for most of the other operations. They also did things like gave our community health workers keys to get in so that they had access for what was needed, because even though things were shut down, as you all experienced, there was still needs for different things. So it was really nice to see that going on. As far as from the community health worker side, they did some different things also. They spent a lot of their time actually delivering things, picking things up for people, not only calling, but also providing them with medicines, with groceries, with different things like that. And then we allowed that to go on and almost didn't encourage it, but said it was fine, kind of let it go by. And even though that they didn't get to go in houses or anything like that, everything was done safely. But we did really they spent a lot of their time more out in the community, picking things up, traveling around, so that they could still provide. So I guess basically that was kind of how we handled things through the COVID-19 and what seems to have worked the best for us.
Thanks, Barbara. Yeah, and I think, especially I think that having that relationship and having those, community-based organizations you work with, even though they were closed, being like, hey, yes, we can, let's bring you in here and make sure that your community health workers can access the resources and go work with the community. So that's great. Cheryl, I'd love to hear more about what you've been seeing in North Carolina.
Yeah, so at Blue Cross and Blue Shield in North Carolina, we've really been focusing around food insecurity. We've been looking at all social determinants of health, but really decided that food insecurity was where we were going to be putting a lot of our investments in. So immediately after COVID, we saw the huge increase around food insecurity, especially with our children, because schools were closed. And so with all of us going home, we have a cafeteria staff on campus that would usually produce probably over 2,000 meals a day. And so when the school systems closed down and they were not able to provide food, one of the first things that we did was open our cafeteria up and begin making meals and taking them out into the local community so the school systems would be able to have food. And so we partnered with our Durham Public School. And so they had a drop-off location. And so we were providing about 1,000 meals a day directly from our cafeteria. And so with that, again, we were able to get these foods directly to the kids that needed it because so many schools had closed. And then we started to look even deeper as that parents were starting to lose their jobs. So then we saw the increase with the number of meals that we were able to produce. So again, in partnership with our cafeteria vendor, we created a hub that's been able to provide meals really across the whole county of Durham right now. And we're looking at seeing how we can expand that. Our cafeteria partner is Compass, which is like a national partner. So they've actually taken some of the work that we've been doing and trying to expand it in other communities, knowing that there are cafeterias that have been closed down because of COVID. And then working directly with the food banks, we realized that people were not coming to volunteer. And so they were having a shortage. So what we did was immediately provided funding for them where they were able to buy box shelf food that would last for about, 14 days, so 2 weeks worth of meals. And by providing that, we ended up providing over 1 million meals across the state where it was easy for the staff to be able to just distribute that without having the volunteers to come in on a regular basis. Along with that, we provided mini grants to those food banks as well, because we realized that a lot of the pantries that they were giving the food to didn't have refrigeration. So we wanted to make sure that as the food was going from the food banks, that the people that were actually getting the food had the refrigeration to be able to keep the food as long as they possibly could. So we did a number of mini grants to organizations and pantries across our state as well. And so again, a lot of our funding right now has been around food. I will say right now we're actually, as a healthcare company, going into our second phase of looking at COVID, and that's going to be more around stopping the spread of COVID, looking at PPE equipment.
That's great. Thanks so much for sharing that, Cheryl. And especially, food insecurity is something that many across the country have seen an increase in that resource need for sure. And especially as we see this debate around schools right now, and knowing that the importance of having schools open for meals and thinking of innovative, creative ways to partner with different organizations in the community to make sure that people still have access to meals is really critical in this time. So thank you. And speaking of food, Tiffany, I'd love to hear from what's going on in Ohio.
Absolutely. So, Cheryl, I want to just give you a shout out. So glad to hear that you're already partnering with your food bank. So happy Wednesday, everyone. My name is Tiffany Scruggs. I serve as the Director of Benefits Outreach and Client Services at the Greater Cleveland Food Bank. Just to share in terms of some of our service delivery, we serve 6 counties in Ohio as one of 12 food banks across the state. Our service territory consists of both metropolitan and also urban communities. So I think Cheryl hit it right on the nose. Being from a food bank, clearly we focused on food insecurity. I think it's exciting as a food bank. Pre-COVID partnerships consisted of clearly partnering with our local school districts, but we have also built strategic relationships with organizations that have specialized in employment, housing, and healthcare, as those serve as the 3 main drivers of food insecurity. So very similar, and it aligns nicely with the social determinant of health movement. We've actually had an opportunity to coordinate with health leads, and so we've been excited to incorporate lessons learned this past 3 years as a previous host site with University Hospitals in Cleveland, where we began to do some referrals via electronic medical records, and that was something we did pre-COVID-19, which has been deemed as a great practice currently. Just a little bit about our program in terms of being out in the community. We have the opportunity to host almost 30 full-time staff that pre-COVID-19 have built a lot of great relationships in the community, helped continue positive brand recognition, where we've had 14 individuals co-located throughout the community. And so the great thing about the food bank that I'm housed at is that we have a call center. So I would encourage you to partner with organizations that offer and have the capacity to host a call center for that over-the-phone support. That has been coined as a best practice, and so definitely excited to talk about some of that as we have our conversation today.
Thanks so much. And I love that, of course, being a food bank, but really thinking about that bigger picture and really looking to strategically address those root causes of food insecurity. And so I know I'm really excited to hear more about all the great work you guys are doing today. And so I do want to say we have one question in that we know Lauren from the Health Collaborative in Cincinnati, our Population Health Strategies at the Health Collaborative in Cincinnati, is looking forward to hearing about model community partnerships and the tenets that really support those partnerships to make them successful. So that's definitely something we'll be focusing on today and bringing that through. And so again, just to everyone on the line, I just want to remind everyone to chat in your questions in the chat box. If you have any what are you facing in your community? Are there any barriers? Have you learned any best practices as we continue to dive into our conversation today? So my next question is about resource gaps. And so we know that within our communities, the resource landscape and the resource availability is really changing quite frequently during COVID. And so really identifying those resource gaps are crucial to really identify then what community partnerships you need to create. And so my question to you is, how are you, including community and patient voice in addressing and identifying those resource needs and gaps? And so let's start backwards this time. Tiffany, I'm going to kick it back to you.
Sure. So I think that is so critical in terms of leaving the patient first, or the client or individual that you're anticipating to serve. So throughout the year, actually 3 to 5 times a year, we incorporate surveying. And that is to better understand, at least in terms of food banking and what other needs exist within the community. We survey individuals via text over the phone and also previously in person. And we've also begun to do that virtually through email requests. But we need to hear from individuals constantly. We can't build programs if we don't hear from those that we intend to serve. So, for example, we recently received some responses from individuals to better understand how we need to respond in terms of food, the quality of food, what types of food. Are we adapting to various cultures and races and ethnicities? And so we have begun to incorporate some of the lessons learned. Also, we've done previously a gap analysis to understand the underserved communities. Are we reaching the people? In terms of when you look at the poverty guidelines, we need to be present and available for those communities that have high poverty rates. So when, Cheryl talked about high or child poverty, we know that because of the current state of COVID-19, we had to be strategic and partner with our school districts. And thanks to the help of the National Guard, which I know everyone does not have access to the National Guard, so I want to make that very clear. But we transformed our model to what's called a grab-and-go style, and that allowed for adults to come and pick up children's meals and take it back home. They did not have to have the children present, and that was actually due to a federal waiver that was in place. So when you talk about it's important to have local, state, and federal partners with senators and other legislators to make sure that they understand your mission pre a pandemic. And so if you haven't built those relationships, I really suggest that you take the opportunity to do so. Even if you don't have an advocacy team, there are definitely other means that you can engage and let those individuals know the important work that you're doing.
Yeah, thank you so much. And I think, like you said, it's so important to have the patient first and the community first in mind. And I love how you guys really are intentional about continuously serving the community and making sure that you guys are really addressing the true needs and making sure that their voice matters and is really prioritized in these conversations. And so, Cheryl, same question to you. How have you guys been doing that in North Carolina?
Yeah, and I'll say I feel like me and Tiffany are so similar here. So we have corporate funders groups, right? So as a corporate funder, we came together with all these organizations across North Carolina, and we started having conversations on a regular basis. So when you think about Blue Cross, we came together with Duke Energy, Duke Health, UNC Hospital. So we brought all of our funders together and started having weekly conversations to start to understand what were we hearing in the community and what were we hearing from our partners. And so once we figured that out, we all really worked closely together to figure out, like, who would fund food, who would fund the education piece, who would do the health piece. And so the money wasn't all being directed towards one place. We all were very strategic about where that money was going. And so I think that was one important thing that came out. And then, like Tiffany, we started talking to our legislators and, key mayors across the cities to understand, like, what were they seeing, what were their needs, and how could we come together to better serve them. And so, again, food definitely kept coming up over and over again. But now we're looking at with the kids possibly being virtually longer, this digital divide, a huge gap that we have around hotspots and having computers in homes. And so now we're starting to shift. Again, I think food will still be a major part, but we're also starting to look at this digital divide that's happening. And so as companies coming together, we're working with AT&T and Spectrum, and then we're also working with Lenovo, right? So Lenovo is able to give Blue Cross a discount for buying computers that also helps the city. So again, looking at those partnerships and how they can overlap and we can all work together. So I'll say if you have corporate partners that are out there, having them to come together and work and truly have conversations helps build a coalition so everyone knows what's happening in the community and be able to share best practices similar to what we're doing here today.
Yeah, I think that's that's such a great point. And I love that, when you guys were looking at it, making sure that you were strategically sharing your resources in the right way so that they all weren't going to one area. And I think that digital divide is definitely going to be felt in communities across the country as schools look at that, do we send kids back or do we keep them virtual? And so, I think looking at how we work with our corporate partners and really leveraging their strengths and ability to get those discounts to really help the community, I think is key for sure. So thank you for that. Barbara, I would love to hear from you and how that's been happening in Kentucky.
Yeah, thank you. So here in Kentucky, I think we're more like a grassroots organization, I guess is how I would describe what our program does. And we actually have community health workers that are located at several of our clinics, our St. Joe's clinics in different cities. So we have Lexington, we have Berea and London, Berea and London being more rural areas. So we're more on that local dive down in kind of a level as far as what we do and what we've seen. And definitely with COVID-19, things have changed. The community health workers were handing out paper screeners to patients as they came into these offices, which range from an OBGYN and a high-risk fertility clinic to peds to primary care. So we were definitely more meeting patients on a daily basis, kind of going through things in that manner and then helping them connect with those resources. Since COVID-19 and the fact that, for a while some of the clinics were closed or they were doing more telehealth visits, what we've seen as far as our resource gaps and what's needed in the community has really changed. So whereas before, food was probably one of our biggest needs, to what you all have addressed, the other panelists have addressed, and we did partner. We have a community partnership with a God's Food Pantry, which actually services 77 counties in Kentucky. We have that partnership, and through that we are able to provide emergency food boxes with 14 to 21 days of food for our patients to take home. Since COVID-19, we've really seen a total decrease in the number of food boxes that we've handed out at the clinic. And as you can imagine, for a number of reasons, people aren't coming into the clinics. People were using Medicaid as their transportation resource to get to the clinic. Well, with the clinics being closed, they weren't needed. So our shift, and then the state of Kentucky and also the whole system has increased SNAP benefits for people. So our food banks here in Kentucky have done a great job with partnering with the schools and getting the food out there. So whereas that was one of our biggest needs and our biggest resources, now we see more things like social isolation. So we have been, the community health workers, when they couldn't do home, visits as far as in person, were actually calling every patient that was scheduled with a provider, either through telehealth. If the patient was scheduled through telehealth or a visit, they were calling all those patients. So they were really seeing, probably talking to more people and seeing more people than what they had done before with the screeners. So social isolation kind of came to the forefront, and we've worked a little bit with our telehealth and our mental health telehealth to get some of that started, and we've pushed for that in our clinics and as far as a source, as a great resource for patients to be able to connect with people. Then the community health workers actually just calling people have helped a lot with social isolation. Another big thing that we've seen is demand for help with like dental, vision, child care, medication assistance. All of those were big in the past, but they've kind of come maybe a little bit more to the forefront, along with like rent and housing. So people were losing jobs here as they were everywhere, and paying bills has been a big problem. So the community health workers have kind of shifted their focus, even for our patients that never needed help before, have shifted their focus more to helping with budgeting, helping with maybe paying a utility bill that wasn't really needed before so that that money could be shifted to pay the rent, or helping with medications, whereas that really wasn't a need before, but we have all these resources that can help with medication assistance, so let's use those so that we can then try to focus some of that extra, some of the money that you had, budget it more toward rent and housing, which are always things that are a lot harder to get help with. So I think that's been some of our biggest shifts, and some of the gaps we've seen is just that those weren't needs that we were identifying as, we were definitely identifying them, but not as much. And then with things like dental and vision, even though we have great resources that we can provide for people, due to things being closed because of COVID-19, we now the lists are so long for people to get in because they can only take so many free and reduced people in a time period for them. So I think, again, I don't have as many answers, I guess, as I do things that have been brought up because of COVID-19 and differences in what we've seen.
Yeah, thank you for sharing that. I mean, all of that is so real right now and felt across the country in so many communities, especially, I mean, social isolation. I mean, we've heard so much about, and I've heard that similarly with a bunch of other organizations. Community health workers are spending so much more time on the phone with patients, and just how critical that time is. And so, yeah, so again, I really want to, encourage the audience, like, as you've just heard, all of these panelists speak to it, but like even with Barbara's, like all the barriers and the increase in needs. And when you have all of these community-based organizations or local government offices shut down, like how are you creating partnerships, or how are you working around that to make sure that people can have access to the needs they need right now? And so, so again, just really want to encourage everyone to submit questions through the chat and the Q&A function. I know another question we've got in to our panelists is, have any of you looked into partnering with Rotary clubs in your communities? And so I don't know if that's something that anyone, either our panelists or if there's even anyone else on the line who has looked into partnering with Rotary clubs at all.
So I'll say this is Cheryl. So I'm actually a member of our Rotary Club in the Durham area. And so we do partner. They're partnering with a lot of the same organizations that we partner with, but they do reach out to us, and we do have plenty of partnerships with them based off of some of the work that we're doing. They work very closely, again, with Durham County. So our strategies really align with what we're doing in the Durham area.
And I'll also, sorry, Megan. I'm just going to respond.
Please go, Tiffany.
That's okay. We also partner with our Rotary Club here at the local level. I just wanted to say that it was so important, as Barbara talked about some of the housing challenges and just challenges in maintaining bills and upkeeping the utilities, et cetera. Here what we partnered with our county council persons and also our utility companies, so individuals would not have a disruption in their utility services until September. And so, I can't speak for your states, but that was a great support for families. So we know that, with the unemployment rate skyrocketed, with some of the delays in terms of some of that financial support, that was just another opportunity to help with on the ground needs in terms of those gaps that individuals shared as a part of COVID-19 response. But yes, the Rotary Clubs is a partner of ours, as we've been blessed to have 21,000 volunteers that we worked with last year, and we're going to continue as we incorporate volunteers back slowly to exceed that number this year.
That's great. Barbara, I don't know if you guys have had any, if you've partnered at all with any Rotary Clubs in your community.
We have, especially in London, Kentucky. So in the smaller communities, yes, we have. And also to address Tiffany, yes, our LIHEAP program has stayed on board and provided utility help all the way. I think now we're all the way through the summer. So in response to that, to the utility bills and the problems that people were having, they have provided some extra funding along with the SNAP benefits and different things to give all of our patients a better chance to, again, do some of that budgeting and move things around. So, yeah, we've had the same experience here in Kentucky.
Thanks. So I hope that answered your question, Aggie. If there's anything else you'd like to add in, please feel free to chat in. But yeah, so thank you for asking that question, and thank you, panelists, for sharing the ways you've worked with Rotary Clubs. And so our next question is really around those equitable partnerships. We've heard, from all of you about how, we've seen these increase in resource gaps. We've identified the areas. And so whether that means maintaining equitable partnerships or building equitable partnerships, and how are we looking at power dynamics? How are we, really making sure that we're sharing decision-making and including the right voices at the table. And so my question to all of you is, how are your organizations thinking of maintaining and building equitable partnerships, especially during COVID, and in the future, if you're looking for new partnerships? And so Cheryl, I'm going to start with you.
So just through our line of work, we're the community and diversity engagement team. And so we're always looking at things from a diversity and an equitable lens. And so just some of the things we've done with a lot of our organizations during COVID has been to unrestrict a lot of our funding, especially for those organizations that are serving people of color or led by people of color, because we understand that they were hit very hard and operational issues were one of the first things that they needed. So being able to unrestrict those funds so they could use them for various things has been huge. We're also looking at doing more granting. We realize that we do have a gap within our own funding as a company around those organizations as well. And so we're looking at definitely over the next, to the end of the year, definitely putting more funding into those areas as well. And so hopefully we'll have more grants towards that. I know our foundation, which is also independent and separate from us as well, also recently was rewarded $10 million to do investments around this work as well. And so I think together we'll partner and make sure that we are reaching more diverse communities within our giving.
Yeah, and I really love that you guys are, with all of your work and with your role in the organization, making sure that everything has that DEI lens to it. And that unrestricted funding is so crucial in a time when having that freedom to be able to spend it on operations or what's best for the community is really crucial and key. So Barbara, I'd love to go to you next.
So as far as what we do here in Kentucky, we really, that hasn't been, I guess, one of our focuses, and that's unfortunate, but it just hasn't, I think our partnerships that we've built ourselves so far between the community health workers and the grant have been more where we found a need, be it food, be it transportation, whatever it is, and then who can we partner with to help us and to help them. So like it may be getting out word of mouth as far as what someone does, or like in the case of God's Pantry with the food, providing those food boxes in the clinics, which obviously helped us, but it also helped the organization because we were able to get out a list. We also provided each patient with a list of all the food banks that were in their area close to them that would be something that they could go to. So we kind of gave them that first box of food to get them started, but then the hope is that with that they would then go on to their own community food banks and use those resources, some of which weren't really used as much as what they should have been. I think people didn't realize that was available. So from our side, as far as what we can do for community partners, it was more of a advertisement kind of a thing. These are some of the places where we've been very successful in getting resources and supplies, and then giving them the opportunity to showcase what they could do. And unfortunately, in Kentucky, especially in our rural areas, we really don't have a lot of diversity, and that's just an open, honest answer. Lexington is definitely more diverse, but when you go out to some of the towns in eastern Kentucky, I'd say it's probably 98% Caucasians. There just isn't a lot of diversity. So funding for that, the poverty rates are really high, and obviously we're working on that and helping patients, but as far as the funding or what we can do, there isn't as much chance to be as diverse as what we would like. Our community benefits dollars, though, and our foundation funds, we do use those to provide as much funding for our partner organizations as we can. So things like God's Pantry or Habitat for Humanity. There's a place called The Nest here in Lexington that we're starting to partner with. So those are some of the ways that we kind of help as best we can to spread out our community benefit dollars. But as far as the whole equitable partnerships diversity-wise, that just really hasn't been something that's been addressed as maybe as much as it should. Hopefully that will change, but for now that's just kind of where we are, just being honest with an answer.
No, and we appreciate that honesty and transparency, because I think a lot of organizations are really now taking, especially in this moment, of recognizing that they haven't had a diversity and equity lens to their partnerships or their work, and are really starting to look at, how can we, really improve upon this and really change the way that either we're, sharing our power or putting our resources into the community. And so so appreciate that answer for sure. And so, Tiffany, I know that equitable partnerships are something that your organization's really been looking at, and so would love to hear about that.
Definitely. I will say that in terms of the Greater Cleveland Food Bank, we had to take a look at ourselves internally in terms of staffing, even at our board level. And so we've made definitely great advancements in terms of diversifying our staff, senior leadership. We've done things like retooling our marketing efforts so that individuals out in the community that receive food understand that we're talking to you. So whether that's age, race, just to make sure that the language for us in terms of that really community-owned data, we understood that we had to get materials translated to Spanish. And so I would just make sure that besides English, know what your second language in terms of in your communities. That is just so critical. So we will continue that. But in terms of food distribution model and partnerships, pre-COVID-19, we partnered with a little over 1,000 organizations to help us distribute food. However, we knew that there were going to be a couple hundred organizations that closed because of COVID-19 and just not being equipped to maintain the safety precautions. And so what we did, we reached out to other community organizations who were not a traditional partner. For example, one of my favorite places, we're stationed at a barbershop, outside of a barbershop, to distribute free children's meals. Now, for those of you who are not aware, in Black and African American communities and brown communities, the barbershop is a popular place. And so that was just really a non-traditional way for us to have a minority-owned business and also make sure that we're available at places that those who need the services most. So that is one example. But traditionally, food banks previously partnered with a lot of churches. So we've expanded that and done other partnerships with other places of worship as some mosques and also synagogues. And so we just have to make sure, and we will continue to monitor that. We're actually working with a DEI consultant to help navigate us through this space these next 3 to 5 years. We recognize that this is not going to change overnight. but we are at, I would say, year 3 in terms of integrating not just internal efforts, but external efforts. But I would also caution for those of you who operate under a board, it has to start at the board level as well. And you have to be very intentional in terms of organizations that you partner with to challenge them to provide their advocacy. We did just kind of a pulse check and environmental scans. Which one of our partners after the terrible incidents with George Floyd, how many made a public statement? And so if they didn't, we just kind of question in terms of, how they feel about structural racism and what they're doing to combat that. So all of that conglomerate of efforts we're going to continue to embark upon during COVID-19 and beyond. And going back to something Cheryl said in terms of PPE, kind of our 2.0, we've been distributing PPE. We know that that's another piece that a large conversation has talked about structural racism and the lack of testing locations and the lack of PPE equipment available to minority communities. And so we did some advocacy, and we were able to jointly increase COVID-19 testings in low-income and communities of color. We've been able to increase and help distribute that PPE equipment and really model by example. As I mentioned, being out in the barbershop, we are always with our PPE equipment. If we see anyone going into the barbershop or leaving, any of the barbers, we're always giving out that equipment as we continue to slow the spread of COVID-19.
Thank you. So I'm sitting here just like nodding away. I was like, yes, all of that is amazing. And especially just thinking about like when we're thinking of who we're partnering with and are they values aligned? Are we challenging our partners and calling them out and calling them in where we need to? And, really make sure that, if we're really want to address a lot of these social determinants of health, we have to look at structural racism. So I really appreciate the way your organization is approaching that. And one of the other points you talked about was, really making sure that your advocacy and your, public health communications are really reaching the community to make sure that you know who your community is. And again, that's the importance of why we want to include the community. And so, Cheryl, I know this was something that you guys have been thinking a lot about too in North Carolina, especially around wearing masks. And so I was wondering if you could talk to that example about how you've been working with partners to make sure that message is being reached to all your different communities.
Yeah, so as a company, what we've done is that we partner with other agencies to be able to give masks out into those communities that are like hotspots. But now we're looking at working with DHS and creating a coalition. And so with that coalition, we're bringing together all partners from across the state. So we're bringing in DHS, who is leading the 3W campaign within our state. But we're looking at how do we talk to the Hornets and the Panthers and our sports agencies and our universities to be able to use their marketing channels as well to be able to amplify the messaging. How do we use partners to be able to supply face coverings directly into those communities that need it? How do we attract the Hispanic population? How do we work in the African American population to make sure that they're getting the relevant message that they need to be able to understand why it's important to wear the facial coverings and to participate in the whole 3W campaign? And so with that, the coalition is coming together. Again, we're looking at our marketing efforts. We're looking at purchasing facial coverings for the state of North Carolina. At Blue Cross and Blue Shield of North Carolina, we're preparing to send out facial coverings to all of our members to make sure that they're protected. And then we're looking at our community partners to make sure that we're also targeting them as well. And so we have a huge partnership with our free clinics. And so we're really looking at organizations again into where are those populations at. And a lot of times, the way North Carolina is situated, we have a lot of large areas, the Charlotte and Durham area, but we're really looking at rural North Carolina as well to understand how can we reach those areas that are really hard to penetrate in. And so again, with us, you're going to hear the word coalition a lot come out of my mouth because as a company, we've realized that we cannot do this alone. And it takes all these corporations to come together, put their energies together and be able to work together. And so that's one thing that we're really pushing. And within this coalition, we have United Healthcare, we have Cigna. Like our goal is to bring everyone to the table to be able to move this because without all of us working together, it's not one organization that's going to stop the spread of COVID. It is really all of us working together. And so the more that we can get our message out and the more that we can help our partner organizations through this, we know that we're going to make North Carolina a better state and a healthier state. And that's our number one thing. And so when I talk about Blue Cross and talk about our members, we're really working for the entire state of North Carolina. And that's how we view the work that we're really doing around the face covering and getting that information out. We're going to do education around it. So again, people are giving out face coverings, but we're missing the educational piece. Tiffany talked about, translations and different things. So we're making sure that our translations are written in conversational style. A lot of time organizations will translate and it's very formal, and we realize that we need to be more conversational within our translations as well. So if you're translating your work, you should not pay someone to take your English translation and put it directly into Spanish, right? It should really be conversational. So there may be words that have to change just because of meanings. And so that's been really important to us in our work. And again, amplifying the messaging in media. It's important for us as we talk about being diversified, making sure that we're reaching those African-American radio stations, those Hispanic radio stations. We just can't go mainstream anymore. It is so important for us to reach people where they are in the community.
Thank you. And I'm like, yes, I completely agree with everything that you're saying and the work that you guys are doing. And again, and it goes to like, you're reaching the community where they're at and where they have trust in the community. And so having all of these different organizations really come together, and, when trust is really hard to find in this country right now, and you don't know what to believe, knowing if there's organizations that you believe in, and like, especially with sports teams, people are going to listen. And so I think that's really important. And so thank you. That's a great answer. And so we have about 5 minutes left. And so again, I want to encourage, if there's any other questions that you guys want to send in, please do. Otherwise, I have one last question to the group. And it's really about the future, which we know COVID-19 is it's not going away as much as we would have liked it to. And so when we think about the future, how are you being proactive in creating a new strategy in addressing your community needs during this time where we're still dealing with COVID, and then also the future? I think this is a moment where we're really evaluating how we can, change for the better. And so I would love to hear how you guys are thinking about that from your organization's perspective. And so, Barbara, I'd love to quickly start with you. And everyone, we do only have 4 minutes, so as quickly as you can within a minute or so.
So as far as the work that I do here, I think that we're looking at COVID from a primary care physician standpoint and the community health workers. And we have made, as I said before, a little bit of a shift from passing out screeners to doing more phone calls and things like that. I think that's going to continue. Also, telehealth has been big part of everything that we've done, from teaching the patients how to use Zoom, community health workers being part of that, calling them, teaching them how to use Zoom, how to be active participants in that, and then working on from the physician side to get all the telehealth set up. So it's a little bit about what we've done. We've also, because the community health workers are so trusted in all their communities, we have provided them with lots of resources, handouts as far as COVID-19, wearing masks, using contact tracing, trying to explain why someone from the state might be calling them because patients aren't always trusting of somebody calling, explain that it may be phone numbers that they may not recognize, but they really probably need to answer their phones, because this is important to make sure that, we're tracing all of our contacts and we're making sure that everyone is safe. So just as a quick summary, I think that's pretty much what we're trying to do and where our focus has been, but obviously making those community health workers, as they already are, an integral part of everything that's going on, and disseminating as much information as we can get out to people, and then connecting them with all the resources that they now need.
Thank you. Yeah, community health workers they are a crucial workforce. I completely agree. So thank you for all your work with that. Cheryl, would love to, what do you envision for the future?
Yeah, really quick, I'll just say listening. We realize that we're going to work with people like Barbara and people like Tiffany to tell us what our community needs. As a corporation, we cannot go in and try to make people do what we want them to do. And so I think you're going to see a lot of corporations listening, want to know what the CBOs are doing, wanting to know where the clients and patients need help at. And we're relying on you guys to really inform us, because I think you're going to see that corporate funding is really going to change. And I think it is changing. And I think COVID has allowed it to change, and people are really going to be, again, listening to the community and wanting to make sure that their dollars are going to the best place that they can possibly put them in the community.
Yeah, I'm very hopeful for that as well. I really think that shift it's going to happen, and people are going to really, organizations and corporations are going to realize, like, yes, we have to, give up the power we have and share that and really equitably come together. So thank you. Tiffany, would love to end with you.
Sure. So Cheryl, thank you. I just want to say we've had such great foundation, corporate sponsorship support, and individual support. We've just seen a great uptick, and so we just always want to continue to thank those supporters. I would just say, in terms of our approach, we've already planned to continue no-touch, low-touch drive-through distributions at a variety of places throughout the community as COVID-19 continues. A non-traditional service in terms of food banking, we will continue our home-delivered meals, prioritizing seniors and disabled households. Because of the federal protections I talked about, we're going to continue to offer those grab-and-go style meals for children and their families. And in terms of getting the word out, one thing I did not mention, but just in terms of our external partners, we have opened up the opportunity to include hard copy paperwork or literature in our disaster boxes and in food boxes. And so we've been able to distribute a little over 100,000 pieces of materials to help keep the community informed for those that are not virtually or digitally connected. So that is just what we will continue to do, and we'll continue to be safe. And you're right, education as it relates to also distribution of PPE is critical, Cheryl. So thank you for saying that.
Thank you. And with that, we are at time. So I just want to thank all of the panelists today for sharing everything that they're doing in their communities right now, and for all of our attendees on the line. Thank you so much for submitting your questions. We will be sending out this recording, and so people will have access to this, as well as we'll create some one-pager with some best practices on it. So thank you all for attending, and I hope you have a great rest of the day. And yeah, thank you again. Really appreciate you guys spending the hour with us.